Okay, let's dig into this. Electronic cigarettes. They're everywhere now, aren't they?
Hmm.
And getting a real handle on the health effects, especially for our lungs, it feels incredibly complex.
It really does. And one of the biggest challenges historically has been untangling vaping effects from, the known damage from traditional smoking.
Exactly. That's the core problem, right?
Right. Because most people who vape either used to smoke cigarettes or they still do.
So if someone develops, say, a cough, how do you tell? Is it the vaping? Or is it years of smoking catching up?
Precisely. And past research often really struggled with that overlap. It's a major confounder.
Which brings us to today's deep dive. Our mission here is to focus on a very specific piece of recent research. It's a systematic review, Caci and colleagues, expected 2025,
Hmm.
and it zeroes in on just one group, people who have never smoked traditional cigarettes. We want to unpack what the evidence gathered in this review says about their respiratory health over time.
Really important focus.
Yeah, and for you listening, maybe you're just curious, or maybe you know someone who vapes but never smokes cigarettes. This diet is really about cutting through some of that noise and seeing what this specific scientific review found for that particular group.
Yeah, trying to get a clearer signal.
So let's start right there. Why is it so absolutely critical to focus only on these never smokers when studying vaping and the lungs?
Well, it really boils down to getting a clean read, like you said.
Yeah.
We know definitively that traditional cigarette smoking causes severe lung diseases, COPD, chronic bronchitis, emphysema, plus symptoms like persistent cough, breathing issues.
The list is long.
It is. So if your study includes people with that kind of smoking history, even if they quit years ago, you're bringing in this huge potential source of noise.
Okay.
Any breathing problem you observe could easily be chalked up to their past smoking, not necessarily e-cigarette use you're trying to study. So, by strictly focusing on individuals with no established smoking history, and that's usually defined as smoking fewer than, say, 100 cigarettes in their whole life, you essentially remove that massive confounding factor.
Got it.
And this review specifically pulled together studies that made that effort, which gives us a clearer, though, as we'll see, maybe still limited view of e-cigarette effects. Well, on their own.
It's like that analogy trying to test a new fertilizer, but you test it on plants with totally different soil, different sunlight. You wouldn't know if the fertilizer did anything, right? You need that controlled comparison.
That's a perfect analogy. You want to isolate the variable, in this case, e-cigarette exposure in people, without the smoking variable messing things up.
Okay, so they set out to isolate that variable. How did the researchers in this particular review actually do it? What kinds of studies did they gather? What were they looking for?
So they performed a systematic review. That means they used a really rigorous, predefined method to search for all the relevant studies out there. And a key thing they looked for were prospective studies. Those are studies that follow people forward in time.
So not just a snapshot, but tracking people.
Exactly. That's crucial because you need to establish that the e-cigarette use came before any potential respiratory problems developed. You track exposure first, then look for outcomes later.
Makes sense for causality, even if it's just observational.
Right. So they searched the big research databases, screened potentially relevant papers against their criteria, and they ended up including 10 studies that fit the bill.
10 studies?
Yeah. And these included both adult and young people who were confirmed never smokers of traditional cigarettes. Then they extracted the data from these 10 studies on various respiratory outcomes.
What kind of outcomes specifically?
They looked at a couple of categories. First, things people reported themselves. So maybe getting a formal diagnosis from a doctor for something like asthma, or just reporting symptoms like, having a cough or wheezing.
Okay, self-reports.
And importantly, they also specifically looked for studies that included objective measures of lung health, if any were available. That's data that doesn't rely on someone's memory or perception.
Like the breathing tests. Spirometry.
Exactly. Spirometry is the main one, measuring how much air you can breathe in and out and how fast. They also noted where the data came from. A lot of it, especially for the U.S., came from a big ongoing health study called the PATH study.
Oh, yes, PATH.
But there were also studies from Canada and a smaller cohort from Italy included. And one last thing, they did assess the quality of these 10 studies, looking at the risk of bias in each one.
Okay, good. So they've got these 10 prospective studies on never smokers. Let's get to the results. What did this review find regarding the more serious stuff? formal diagnoses, severe respiratory conditions.
Yeah, this is probably one of the most striking findings reported in the review. Overall, when they synthesized the data looking specifically at formally diagnosed respiratory diseases, or what you might call more severe outcomes, the review concluded there was no statistically significant association found with e-cigarette use among these never smokers.
Wait, hang on. No significant link for things like getting diagnosed with asthma or other, doctor-diagnosed lung diseases, specifically in people who only vaped and never smoked cigarettes.
Based on the combined evidence from the studies included in this review, that was the conclusion for those types of outcomes.
That might surprise some people.
It's certainly a noteworthy finding. They mentioned that across 7 studies that looked at these more severe endpoints, the results just didn't meet the usual statistical threshold to say there's a definite link.
Can you give an example?
Sure. So, for instance, a couple of studies specifically tracked the onset of asthma. So, new cases developing during the study period among young people who'd never smoked.
Right.
Those studies didn't find a significant increase in asthma onset linked to their e-cigarette use.
And what about in adults? Was it the same?
Mostly, yes, but there was one finding that really underscores why that never smoker definition is so critical.
How so?
One study initially did seem to show a link. It suggested that among adults who never smoked cigarettes but used e-cigarettes, they had an earlier onset of asthma.
Okay.
But crucially, when that same study reran their analysis and strictly excluded anyone who had ever used any other type of combustible tobacco, like cigars or pipes, even if just occasionally at the start,
Okay.
that association with earlier asthma onset just vanished. It became non-significant.
Wow. So even a little bit of use of other things you burn and inhale could potentially skew the results that much.
It seems so. It really highlights how vital it is to isolate people who are truly naive to any kind of combustion product when you're trying to understand vaping effects alone. So yeah, the summary for severe outcomes or diagnosed diseases based on this review's evidence pool is that there wasn't a clear, strong link found for never smokers of traditional cigarettes, at least within the time frames these studies covered, which were mostly, short to medium term, like 1 to 5 years.
All right. So if the big, serious diagnosed conditions aren't strongly showing up in this particular set of studies, what about the less severe stuff? The everyday symptoms, maybe a nagging cough or some wheezing.
Okay. Yes, this is where the picture definitely gets, let's say, less clear, more complicated.
That's so.
For those milder symptoms, like self-reported coughing and wheezing, the findings across the different studies included in the review were actually pretty mixed.
Mixed, meaning some found a link and others didn't.
Exactly that. There were several studies included that reported no significant association between e-cigarette use and reporting these kinds of symptoms among the never smokers they followed.
Okay, so some found nothing significant.
Right. But then other studies did report significant associations. They found that never smokers who used e-cigarettes were more likely to report experiencing cough or wheeze compared to never smokers who didn't vape.
So why the difference if they're all looking at never smokers?
Well, that's the tricky part, and it gets a bit technical. The review itself described the evidence for these symptoms as somewhat tenuous, or noted that finding an association sometimes depended on how the statistical analysis was performed.
What does that mean exactly?
It means the results could change depending on, say, exactly how cough or wheeze was defined or measured in that specific study.
Okay.
Or how the researchers statistically controlled for other factors, maybe even tiny amounts of past exposure to any tobacco product. It wasn't this strong, consistent signal popping up in every study the same way.
Right?
Which suggests that if there is a link between vaping and these milder symptoms in never smokers, it might be, subtle or maybe not consistent across different patterns of use, or perhaps easily influenced by other things going on.
So it's not a clear, yes, vaping definitely causes a cough in never smokers, nor is it a definite, no, it doesn't. It sounds more like maybe, sometimes it depends, and the evidence we have right now is a bit shaky or hard to pin down.
That's a very fair summary of what this review seems to suggest regarding those self-reported milder symptoms. It's murky.
Okay, so we have self-reported symptoms being mixed. Did any of these 10 studies actually measure lung function? Using the objective tests, the machines?
Yes, that's a really critical question. And this is where the data presented in this review becomes the most limited.
How limited?
Extremely. Out of all 10 studies they included that followed never smokers over time, only one single study actually used objective measures of lung health.
Just one out of 10. Wow. Okay, what did that one study do and what did it find?
So this was a relatively small study conducted in Italy. They followed a very small group of people, just 9 adults who had never smoked traditional cigarettes but were daily e-cigarette users.
9 people. Okay.
And they compared them to 12 similar adults who didn't use e-cigarettes or traditional cigarettes to this control group. They followed these individuals for, on average, about 3.5 years.
And what objective tests did they run on this small group over those years?
They did quite a bit, actually, considering the size. They performed standard lung function tests using spirometry.
Right, the breathing tests.
They measured certain biomarkers in the participants' exhaled breath, which can sometimes indicate inflammation or other changes.
Okay.
And they even did high-resolution computed tomography, HRCT scans of the lungs, which give a very detailed picture of the lung structure.
That does sound very thorough for, well, 21 people total. What did they find after following them for 3.5 years?
The key finding reported from this specific Italian study was that over that 3.5-year period, they found no detectable modifications or significant differences between the groups.
No changes in what?
In the lung function measured by spirometry, no significant changes in those exhaled biomarkers they measured, and importantly, no signs of structural abnormalities or damage appearing on the detailed lung CT scans in the e-cigarette users compared to the controls.
So on the one hand, that sounds, well, reassuring from that single study's objective data.
It does.
But, I mean, you have to emphasize it's just one study with only 9 e-cigarette users.
Absolutely. That cannot be stressed enough. It is a very small study. While the findings are interesting and perhaps reassuring in the context of those specific measures over that time frame,
Yeah.
you simply cannot draw broad, definitive conclusions about the safety or long-term objective effects of e-cigarettes in all never smokers based on data from just 9 people. It provides a valuable initial piece of objective data, but it's nowhere near enough to settle the question. Far from it.
Okay, that makes total sense. So let's try to pull this all together from this specific systematic review by Caci and colleagues. For people who have never smoked traditional cigarettes, the findings suggest no strong, clear link to severe respiratory diseases over the short to medium term covered by these studies.
Correct, based on this evidence synthesis.
For milder symptoms like cough or wheeze, the evidence is mixed, maybe tenuous, harder to interpret consistently.
That seems to be the picture for self-reported symptoms, yes.
And for objective measures of actual lung function or damage, the data is extremely limited. Basically, one small study finding no changes over 3.5 years, but it's just that, one small study.
That accurately summarizes the key takeaways from this review's analysis. And, the review itself does connect this back to the broader public health context, which is that e-cigarettes are primarily considered and regulated in many places as a potential harm reduction tool, specifically for adults who already smoke combustible cigarettes and are finding it hard to quit using other methods.
Right, offering a less harmful alternative to smoking.
Potentially, yes. So these findings in never smokers, while important for understanding potential risks if that group initiates use, they don't really change that primary framing of e-cigarettes as a tool intended for current smokers looking to reduce harm.
Got it. They weren't designed for never smokers in the first place. But still, understanding what happens if they do use them is important science. Now, like any good scientific review, it's not the final word. You mentioned limitations. What did the review say were the big caveats here?
Absolutely. And the authors were upfront about several critical limitations in the underlying studies, which means we need to be cautious in interpreting these findings and recognize the remaining gaps.
Okay, like what?
Well, first, nearly all the studies included were observational. They tracked people, but didn't randomly assign them to vape or not vape, like in a clinical trial.
So they can show associations like vaping and symptom X occur together more often, but they can't definitively prove cause and effect.
Exactly. There's always the possibility that some other unmeasured factor is responsible for the link, or lack of link, that they observed. Correlation isn't causation.
Right. What else?
Second, as we discussed, much of the data, especially on symptoms and even diagnoses, relied on self-report. People's memories aren't perfect. Reporting can be influenced by expectations. It's just not as solid as objective measurement.
Makes sense. Any other big ones?
Yes, the potential for confounding by other factors that affect lung health. Things like exposure to air pollution, underlying allergies or asthma predisposition, genetic factors, even other respiratory infections. These weren't always perfectly measured or controlled for in every single study.
The usual suspects in respiratory research.
But perhaps one of the most significant limitations, highlighted strongly in the review, was the small number of never-smoking e-cigarette users included in many of the individual studies.
We talked about the Italian study with 9 users, but was this a broader problem?
Yes. Because think about it, vaping is still far less common among people who've never smoked compared to current or former smokers. So even in large general population studies, the actual number of participants who fit the criteria never smoke cigarettes and currently use e-cigarettes was often quite small.
And why is having only a few people in that key group such a big issue?
It leads to low statistical power. And this is really, really crucial to understand. If e-cigarette use does have a real, but perhaps relatively small, negative effect on respiratory health in never smokers, studies with low power meaning, studies with too few participants in that group might simply fail to detect that effect as statistically significant.
So the effect could be there, but the study is too small to reliably find it.
Precisely. As the review explicitly notes, and it's a fundamental principle of interpreting research, absence of evidence is not evidence of absence, especially when your study might not have been powerful enough to find the evidence in the first place.
That's a critical takeaway. Just because these studies didn't find a strong link doesn't automatically mean there is no link at all. They might just have lacked the statistical muscle to see it.
Exactly. The signal, if it exists and is small, might just be too faint for the instruments the studies we've used so far. And one final limitation, the follow-up time.
Right. You mentioned mostly 1 to 5 years.
Yes. And many serious respiratory diseases, particularly things related to long-term damage like COPD or potentially even cancer risk, although that wasn't the focus here, can take many, many years, often decades of exposure to develop and become clinically apparent.
Like the decades of smoking needed for lung cancer risk to become very high.
That kind of time frame. So if there are harmful respiratory effects from vaping that only manifest after, say, 10, 15, or 20 years of use, studies looking at people for only 1 to 5 years would completely miss them, even if subtle changes were already beginning at a microscopic level.
Okay, so given all these limitations, observational data, self-reports, potential confounders, small samples of never-smoking vapors, and short follow-up, what's the path forward? What does the research community need to do next?
Well, the review lays out a pretty clear roadmap based on these gaps. We obviously need more research. Specifically, we need larger studies that enroll enough never-smoking e-cigarette users to give us adequate statistical power to detect potentially smaller effects.
Deeper numbers in that key group.
Yes. And critically, we need studies with much longer follow-up periods, getting well beyond that 5-year mark, ideally tracking people for 10 years or more to capture potential long-term outcomes.
Makes sense. What else?
Future studies should also try to collect more detailed information on the patterns of e-cigarette use. Not just yes, no, but how often people vape, what kind of devices they use, what liquids, what nicotine levels, which flavors.
Getting into the nitty-gritty of exposure.
Right, because the effects might differ based on how someone vapes, not just if they vape.
And finally, the review calls for more independent research conducted in diverse populations and countries to make sure findings aren't just specific to, say, the U.S. context, where much of the current data originates.
So broaden the scope geographically and demographically, too.
Exactly.
This has been a really clarifying deep dive into this specific review. We've unpacked how, for never smokers, the current evidence gathered here, while acknowledging all those limitations, doesn't point to a strong link with severe respiratory diseases in the short to medium term.
But the picture for milder symptoms like cough or wheeze is much less clear, sort of mixed and uncertain.
Right, more tenuous.
And crucially, the objective data on actual lung function or damage is really sparse, with the existing studies hampered by small numbers of never-smoking vapors and relatively short observation times.
That captures the state of the evidence as presented in this particular review quite well. It's very much an evolving picture.
It really is. And that actually brings up a fascinating challenge, maybe a final thought for you, our listener, to mull over. When we're faced with scientific data that's limited like this, especially concerning potential long-term effects, and in specific, relatively small groups like never smokers who start vaping, how do we as individuals and as a society weigh those potential risks? Risks that are uncertain, maybe small, not yet clearly demonstrated?
Right.
How do we balance that against the known, severe, and frankly undeniable risks that come with smoking traditional cigarettes? It's a really complex space, isn't it? Where clear-cut answers are still being built, study by study, review by review.
It absolutely is a very complex intersection of science, individual choice, and public health policy.
Definitely something to think about.
Indeed.